For this study, we followed a large cohort of kids aged 8 to 12. And in this study, the goal was to see if the incidence level of injury of concussion was higher in this age group. There's a lot of speculation and a lot of decisions have been made before having any data to limit contact practices for kids due to the concerns about concussion. And what we've done here is we've done the largest prospective study examining the actual incidence rate of concussions in Pop Warner football players aged 8 to 12. And what we learned, very importantly, is that first of all, the incidence rate of concussion is actually comparable for Pop Warner football players as it is for high school and collegiate athletes. We didn't see any increased risk of concussion in this cohort of kids. Perhaps most importantly, we found that if there is a concussion that occurs, it's occurring in games and not practices. The actual incidence of concussion in practice was pretty much none. We actually feel that limiting practice time in youth football players could actually have deleterious or lead to poor outcomes, because practice time is a time that kids learn how to properly tackle. They learn the right technique. They can be educated about how not to use the head as a weapon, the proper way to tackle an opponent, the proper way to engage in football. And we feel practice times are especially critical to teach kids the right way to tackle and play the game of football. In short, these findings would suggest that youth football is a safe sport, and we actually really recommend educational efforts surrounding this topic before we make any other decisions regarding, limiting contact football.